So we will also close our cameras and yeah, we start the webinar now.
Should I start? We have Professor, welcome. Welcome to all participants. We are so excited to start this very special event of a collaboration between the African Union Commission on Stigmatization and COVID-19, the United Nations University Institute for Global Health, and the School of Public Health at the University of Cape Town. And we are here we're so privileged to convene this launch with the ExCon, with the blessings and the convening power of the government of Egypt. And we have our colleagues in Cairo who are in a large conference room with us. And we are also live streaming. So we're delighted to bring together all these constituencies online through the Zoom webinar, live streaming, as well as in Cairo. We are looking forward to starting this conversation with you on how do we bring together many different stakeholders to advance gender and health in the African region. Welcome to this launch, and let me give you an overview. I'm Asha George. I'm a professor at the School of Public Health at the University of the Western Cape, and I'm so privileged to be working with such a terrific team, with so many people across the continent to work on gender and health and really have an impact. Can we go to the next slide? I'm going to give you an overview of a few housekeeping rules for those of you who are online, and in terms of how we keep this conversation going. So please, we're looking forward to having this as an interactive session. So please use the Q&A chat to submit your questions, comments. We look forward to hearing from you. While the webinar is live, we ask you to to keep your microphone muted. And just to note that this event will be recorded, and there'll be a few other key guidance points put in the chat. I'm just going to give you an overview of the webinar to orient those online, and we are just waiting for a few key speakers in Cairo. So this is the program for today. We are incredibly privileged to have to be graced and have opening remarks by several high-level speakers who are in Cairo, as well as with Professor Francine Ntumi, who is online from Congo. I will be introducing them formally shortly. So we have a few key opening statements providing the context to this community of practice, contextualizing our presence at the ExCon, as well as giving us an overview of what are key, highlighting the findings of why this community of practice is so needed, and what are the key issues on the African continent we need to be addressing. We will then have a very brief presentation where we give you a sense of some of the work we have been doing in setting up the community of practice. And my colleague, Dr. Joanna Riha, will also be sharing. Many of you responded to a survey. We wanted this community of practice to be very much defined by your inputs And so we are very happy to share some of the findings of what you said, what that initial, who are the people who responded, but also their key inputs and ideas for how key elements of the community of practice. Then we will have an open session, a roving mic in Cairo, as well as find a way to bring in your questions so that we get additional input. It would be lovely to have your reflections on what the keynote speakers have said, as well as the any reflections based on the presentations we made, burning issues and questions that you have. We are really looking forward to hearing from you. And then we're very privileged to have some closing remarks by Professor Maha El-Rabat, the former Ministry of Health and Population from Egypt, and the former WHO Director General and Director General Special Envoy on COVID-19, who will give us some closing reflections on the community of practice and her perspective here on gender and health. Let me introduce the key speakers. We're delighted that Professor Adawi is here. Let me give you an overview of those who are going to be speaking. Again, we're incredibly privileged to be hosting this launch as a hybrid event at the ExCon in Cairo, Egypt, kindly convened and welcomed by Professor Dr. Adel Adawi, President of the Egyptian Medical Association and former Minister of Health and Population from Egypt. The other keynote speakers, let me just introduce them all in a row and then hand over to Professor Dr. Adawi. Professor Dr. Agnes Binawahu has always been part of this collaboration. She's the former Minister of Health in Rwanda and has played many critical roles. She unfortunately could not make it, but she has a statement that will be read out by Dr. Loazi in the room. We're delighted to have a presentation by Professor Olive Shisana. She is the special, amongst many important roles, she's the special advisor on social policy to the President of South Africa. We're delighted to have her provide some context to the community of practice and why this is such an important collaboration. And last, but certainly not least, we have online Professor Francine Ntumi. She's the executive director of the Congolese Foundation for Medical Research, a key leader advancing research on key health issues from the African continent. So we're so excited to hear from these speakers, their perspectives on gender and health and this community of practice. Let me hand over to and welcome Professor Dr. Adel Adawi for his comments. Thank you.
Good morning, everybody. I'd like to welcome you all in the second Africa Health ExCon. It's a great opportunity to welcome all our guests, Dr. Olive Shisana, and our friend, all our friends from the African continent, also our friend Loazi, the dynamo of the African Union, and also all the activities in our Africa Health ExCon from last year, and my colleague, Her Excellency Dr. Maha El-Rabat, for inviting me to attend with you this initiative, or this very important initiative about promoting gender mainstreaming and gender equality in Africa. We know well that in Africa, women particularly were suffering from a lot of deficiencies, from unpaid domestic and care works, lack of access to education and health services, lack of resources and opportunities for economic activities, and limited participation in politics and decision-making, and the prevalence of gender-based violence also. sexual violence, FGM, and child marriage. So we will have a lot to interact and integrate together to promote the gender equality and health in African continent. So we should promote the cooperation that aims for gender equality and women's empowerment as its primary target, and the cooperation that gender equality and women's empowerment are not its primary target, while we still integrates gender perspectives, also promote gender mainstreaming in Africa. So I'd like to welcome you all, and thank you for inviting me to attend this initiative with you in our conference. Thank you very much.
Thank you so much, Dr. Adel Adawi, for opening the launch and highlighting key issues that are of critical importance to the African region in terms of FGM, the importance of integrating gender into the health sector, and child marriage, amongst many other critical issues that we must be addressing. May I welcome Dr. Loazi to the stage. She is going to read the statement from Dr. Agnès Binagwaho, who has been a key collaborator in convening this space, but who couldn't be with us at this moment. Over to you, Dr. Loazi. Thank you.
Okay, thank you so much. And it is really lovely to be able to be at this point where we are launching the community of practice. And Professor Binagwaho sends her warm greetings. Unfortunately, due to the time change, she was no longer able to make it, but she did ask me to read her statement. And so let me read it here. She writes, "Esteemed fellow speakers, valued stakeholders, and ladies and gentlemen, I'm honored to be part of this wonderful occasion today as we launch a community of practice for gender and health in Africa. As we had heard, we will hear from Professor Shisana that we are not progressing towards realizing good health outcomes for women, children, and adolescents. Despite a great deal of advocacy and lobbying to apply a gender lens to our health interventions, the truth of the statistics will show that we are still losing lives and that women and their children, especially in Africa, continue to suffer from preventable conditions. There are many factors that seem to frustrate our ability to attain the goals we have envisioned, which only means that a platform like this could not be more timely. I had the privilege of attending the initial consultation session, which was attended by 97 participants, mainly ground implementers, but also academia, civil society, and I always value gatherings where the focus is on ground implementers. We gathered with 3 objectives at the time. Firstly, to make a case for key stakeholders on the continent to come together to collectively source research priorities and best practices with regards to gender equality and health. Secondly, to provide a space to hear from other voices on the continent with respect to the formation of this collaborative platform. Thirdly, to explore key priority areas and the determinants related to gender equality and health, specifically related to the COVID-19 response that could be addressed by the collaborative platform. I would like to highlight some important issues that were raised, which led us to establishing the community of practice. First, you identified a need for this platform because there was too much fragmentation on the global and regional architectures, that there was a need for greater focus on monitoring and evaluation, that there needed to be greater interactions between the interveners and target groups, a greater focus on prevention, and more inclusion of youth. You emphasized that the network should be able to react quickly, have better understanding of local contexts, and apply implementation measures and strategies from the global, regional, or country-specific examples that address context-specific issues in gender equality and health. As a collective, we resolved as next steps then to, firstly, conduct a mapping of key partners from across the continent while working at the intersection of gender equality and health, with a particular focus on the response to COVID-19. Then we decided to develop linkages and continue to have conversations and dialogue with potential partners and key stakeholders. And finally, we decided to collectively define the potential scope and value addition of the platform or network. As such, we did conduct a research survey to understand our prospective participants better and define a modus operandi, and Professor Asher George will take us through this piece and its findings. What we have understood is that you want to be more closely connected to each other, the people you serve, and the entities that enable you, like funders, policymakers, lawmakers, academics, and leaders of civil society. You also called for the inclusion of strong male allies, and on the other hand, you emphasized that identifying job opportunities for men is also crucial to alleviate gender-based violence and mental illness in youth. This was a very specific recommendation you made in light of pervasive gender-related issues. As COVID-19 Commission, we wish to recommit our support to this endeavor. We will continue to play a strategic role, positioning this platform in a manner that attracts the right people and entities to each other to coordinate for real change in the lived experience of women and the people they care for. Accountability is the cornerstone of success. We will pay particular attention to this aspect of the community of practice, ensuring that we ultimately work together to be accountable to the people of Africa. We thank you all for your deep commitment to realizing quality healthcare for all vulnerable groups. Let us ensure that this platform delivers good results and makes a real difference. My sincere thanks goes to the organizers of this event and the leadership of Africa ExCon for making this launch happen. Finally, I wish to thank the champion on COVID-19 for his leadership that shows care and compassion to women, children, and adolescents all over the world. And I wish to thank the Bureau of the African Union Heads of State and Government for maintaining attention on gender equality, which is that all crucial political will that enables us to mobilize resources and push for positive change. Chair, I submit the statement from Professor Benagwaho. Thank you.
Thank you so much, Dr. Luazi, for reading that wonderful and such an articulate statement from Dr. Agnes Binagwaho, highlighting again the urgency of various gender and health issues, but also reflecting some of the key inputs we've heard from members of the community of practice about how we should shape this community of practice for it to have real policy impact, who should be involved as members, and how are the ways we're going to collaborate and the key issues involved. Thank you so much. It's wonderful to see the leadership across all the panelists advocating for change for gender and health across the African continent. Let me introduce to you Professor Olive Shisana. For many of you, she requires no introduction like the other speakers. She has been a force for change on the continent, and we are incredibly lucky to have her perspectives here on gender and health on the African continent. As I said, she's currently the Special Advisor on Social Policy for the President of South Africa. Welcome, Dr. Shisana.
Thank you very much, and good morning to you in South Africa and all over the world, as well as for those that are here in the meeting in Cairo. I'm going to be talking about the launch of this program, which aims to provide high-quality health services to women, children, and adolescents. Next slide, please. We are experiencing a serious situation with regard to maternal and newborn health indicators. We are seeing the worsening of this situation. That progress that we had seen before has been interrupted by the COVID-19 Commission. So we've seen a reduction in deaths of pregnant women, mothers, and babies, but that reduction has been slowed, and in fact, it has been flatlined for 8 years because of the decreasing investments in maternal and newborn health, but also, as I indicated, is due to the COVID-19. We now have 4.5 million women and babies who are dying every year during pregnancy, childbirth, or the first weeks after birth. That is equivalent to one death happening every 7 seconds, mostly from preventable or treatable causes if proper care is not made available. Next slide, please. Another complicating problem that we are experiencing is gender-based violence in Africa. Many countries are really experiencing this inhumane treatment, of women. We are seeing an increase in gender-based violence reported in all of the regions of Africa. In some areas, we have about half of the population of women experiencing gender-based violence. In addition to that, we're experiencing an increase in harmful traditional practices such as female genital mutilation. And this has been recognized by the African Union as early as 2020 during the period of the COVID-19 pandemic. Next slide, please. Now, COVID-19 has had a massive impact on health services. Even though some people keep thinking we no longer have COVID-19, we should really keep emphasizing the fact that COVID-19 is still with us. We still have cases of COVID-19 and people are still dying from COVID-19. It's not as frequent as it was, but what it has done, COVID-19, was to decrease the use of health services. And in addition to that, it has exacerbated the shortage of resources, with regard to staff and resources, health facilities, especially when you think about the first wave, when we had the Delta variant that was really vicious in terms of taking away the benefits that countries had. We have not really fully recovered because 40% of African countries are still experiencing disruptions to services such as sexual and reproductive health, maternal newborns, child and adolescent health services. And that is why we're seeing the reversal of the progress that we had made in these particular areas. We have seen an increase in home deliveries. We are seeing also later care for obstetric complications. Women are coming in late with complications. And we've seen an increase in unintended pregnancies, particularly for adolescent girls. All of these things happen because of the COVID-19 pandemic and also lack of investments, as I indicated, into this area. COVID-19 has also had an impact on mental health of women as well as that of girls. But the other people that really got the brunt of COVID-19 were the health workers. They suffered extensively because they were in the front line of taking care of those that were afflicted with COVID-19. Next slide, please. So, what should be done? Well, the AU champion on COVID-19, President Cyril Ramaphosa, he was mandated by the AU to really unpack societal impact of COVID-19, particularly on women, children, and adolescents. And in order to do this work, and overall on COVID-19, he set up a commission, and that AU commission is comprised of experts across the African continent who are located in all of the 6 regions, of Africa. And some of those I am listing out here. The Professor Sinaid Fiseha, Professor Agnes Binagwaho, Professor Francine Dumi, working together with the Secretariat of the COVID-19 Commission, Dr. Lwazi Manzi, they form part of the Gender and Stigmatization Working Group. And they are working closely with the UN University Gender Hub, as well as the School of Public Health in the Western region, to really unpack the impact of COVID on women and children and adolescents and come up with suggestions on what needs to be done to prevent, mortality, morbidity, and the suffering, of women, children, and adolescents. Next slide, please. Now, this launch would have never been possible unless we had leaders who had foresight, who had vision, who were prepared to put their neck out there to deal with the issues that we're addressing here. So the leadership of Africa ExCon decided to provide this platform so that we can be able to launch this program. Professor Maha El-Rabat, she brokered the inclusion of the launch on the margins of this particular meeting, and we thank you so much, for doing so. We also thank Professor Adel Adawi, who really opened his arms and heart and said, I am available to assist. I must tell you, throughout my stay here in Cairo, he has been in so many meetings with me. He has been speaking and supportive, of the work that we're doing in public health. Really, we should give him a hand. Next slide, please. There is another initiative that really complements very well what it is we are doing here today, which I would like to share with you on. President has been asked to lead a network of 10 sitting heads of state who are going to a lot of work is currently now defining the program together with maternal partnership maternal health, as well as the presidency. Next slide, please. Coming now to the Community of Practice for Gender and Health in Africa. This particular group has recognized that the low and middle income countries face massive challenges post-COVID-19. The challenges that are observed relate to the economic recession. After 25 years of growth, we're now seeing a reversal of the economic growth, and it's hitting Africa also very hard. Also, there is waning and fragmented donor funding. The funders are no longer so much interested in this. They've moved on to other challenges. What other thing that complicates the situation is the war in some of the parts of Africa. We are warring, and when we enter into war, we take money away from the programs that are critical for women, children, and adolescents. Some of the challenges that we have is that we are running out of commodities, and in particular, I'm going to talk about one, contraceptives. And the reason we're running out of contraceptives is because the manufacturers have stopped making contraceptives. So we in Africa need to start manufacturing the contraceptives for our women. And we have a challenge because we just continue importing many of biotechnology rather than really creating it within our own countries. We need to be focusing on our biotech sovereignty, make sure that we can be able to produce the technology that we need in order to protect the health of our women and children, but also the health of our population overall. So we are also concerned in terms of the challenges that the Community of Practice on Gender and Health is observing, that sustainable development for health is actually flatlining we are not seeing an improvement when we are actually supposed to do that. That is why we now have this Community of Practice for Gender and Health in Africa. That's why we have it formed to be able to address some of these challenges. Next slide, please. Now, there are many ways that we can be able to address some of these issues using the gender lens. And one way of doing it is really to look at political leadership. Without political leadership, we are never going to be able to achieve what we want to do, despite the resources that we may have, whether it may be human or financial. You need political champions to stand out there and make people aware of the importance, of the challenges related to gender interventions. Secondly, we have to look at the innovative financing. We have to find other ways, because governments are not paying enough resources to ensure that women and children can be able to get the services they need. We also need, thirdly, meaningful partnerships. And meaningful partnerships are critical in the sense that we have to be respected when we make our own input. It should be taken into account by those that are developing programs and policies. And these are the words in terms of the political leadership, innovation, meaningful partnership that were espoused by President Ramaphosa and the Honorable Clark, who is the chair of the board of the PMNCH. Next slide, please. Now, we have to create an enabling environment in order for things to happen. And this particular community of practice is a platform that will use the critical elements that I've just mentioned, the 3 critical elements that are necessary for moving the gender program forward. They are coming together in the spirit of creating an enabling environment for ground implementers, for you who are implementing on the ground, you who make a difference in the lived experience of women and children in Africa. We are here today to connect you to information, to resources, to power, and connect you to each other so that together, as a community, we regain the pathway towards universal health coverage and build a prosperous future for women, children, and adolescents in Africa and the world. With these words, I'd like to thank you very much and to launch this particular initiative. Thank you.
Thank you so much, Dr. Shisana. That gave us really a wonderful overview of the context, the challenges we face, but also the very important contributions and collaborations that have come together to forge this community of practice. I'm delighted also to welcome, thank you very much. We look forward to your continued engagement as we take this series forward. I would like now to really warmly welcome Dr. Francine Ntumi. She's the Executive Director of the Congolese Foundation for Medical Research. She's joining us from her office. Please, Dr. Ntumi, welcome to this meeting and launch.
Good morning, everyone from Brazzaville. Bonjour tout le monde depuis Brazzaville. Comme il y a des interpréteurs, l'interprétation de français en anglais, je vais en profiter. Et cela va montrer que justement, ce groupe de travail mis en place est multilingual et donc implique des partenaires de différentes zones. Je voudrais d'abord remercier vraiment les organisateurs pour l'honneur qu'ils me font de m'inviter à participer au lancement de cette importante plateforme de communauté, sur la communauté de pratique en sciences, pour le genre et la santé, excusez-moi. Je suis donc biologiste moléculaire travaillant sur les maladies infectieuses depuis plus de 20 ans. Et là, je vois 2 aspects. en tant que femme africaine, scientifique africaine, la faible représentation. Évidemment, quand on regarde l'Afrique du Sud, qui a plus de 50%, un nombre important de femmes dans les sciences, mais on voit que ce n'est pas le cas de beaucoup de régions. Et dans ma région, l'Afrique centrale, c'est en moyenne 10-12% de femmes dans les sciences représentées. Donc là, il y a une inégalité qu'il va falloir vraiment, où il va falloir agir. Je travaille aussi sur le paludisme, qui est une maladie qui impacte beaucoup nos vies, notre pouvoir économique. Et que voit-on dans le paludisme? Ce sont les femmes et les enfants qui paient le plus lourd tribut à cette maladie. Et que voit-on? Les essais cliniques, les études sont peu conduites dans ces populations. On les voit peu participer, ce qui fait que les traitements que l'on trouve, traitements, vaccins que l'on trouve, sont d'abord en fait préparés pour les adultes avant d'être réellement évalués, efficaces sur les enfants ou les femmes enceintes. Donc, là aussi, il y a une inégalité dans la participation de nos populations vulnérables qui sont les récipiendaires premiers de notre réflexion, de nos recherches. Cette communauté de pratique est une plateforme importante parce qu'elle va permettre vraiment de nous donner l'appropriation de nos questions, d'identifier nos besoins, comme l'ont dit les précédents speakers, mais trouver nos solutions adaptées régionalement en fonction de notre contexte. Cela va nous permettre aussi une meilleure communication, une synergie de nos efforts au lieu d'avoir souvent des duplications, répétitions dans un moment où nous n'avons même pas toutes les ressources financières suffisantes. Donc, cette plateforme va permettre meilleure coordination, synergie et évidemment, en impliquant tout le monde, va permettre une meilleure productivité, quels qu'en soient les domaines. Donc, pour finir, je dirais vraiment que ce que je souhaite en joignant vraiment mon speech, mes recommandations à celles des précédents speakers, c'est vraiment que nous adhérions à cette communauté de pratique ensemble, que nous apportions nos contributions, mais que surtout nous appliquions ensuite, nous participions sur le terrain à l'application de ces bonnes pratiques. Voilà, donc encore une fois, je remercie les organisateurs de m'avoir invité à partager mon point de vue et je nous souhaite vraiment un très bon webinaire. Merci.
Merci beaucoup, Madame Professor Francine Ntumi. She spoke so eloquently about the representation of female scientists on the African continent. She highlighted the gender elements in malaria research that she has championed. Throughout the BMJ Gender and COVID-19 special series on gender and COVID-19. We'll put the links in there. And one thing she highlighted was the lack of representation of women and children in clinical research, that a lot of the research on malaria vaccines is primarily done on adult men. And we really need to advance the science and the representation of women and children in vaccine research. And that was the top priority in our work on collectively shaping research priorities for gender and COVID-19 research as well. So I'm really pleased that the same messages are echoing across fields of research in terms of highlighting their relevance. She called for greater alignment and synergy given the lack of resources and the importance of not wasting efforts, and really that this is an exciting webinar, but what is also critically important is what happens after the webinar and how we take these conversations from meeting together to actually take through the knowledge and the motivation to affect change in our own workplaces all over the continent. Thank you so much for all the opening speakers. I think that was an excellent kickstart to understanding the leadership that this continent has, the much hope we have in terms of really highlighting these key issues, and looking forward to working with you on through this community of practice as one example of the collaborations we need to forge. I'm going to do a very brief introduction to some of our thinking and origins. A lot has been said by the previous speakers, so it'll just be a brief presentation for those who joined more recently on the regional community of practice. Can we have the next slide, please? So to just recap, it was really a partnership that has been brought together by the AU COVID-19 Commission Gender and Stigmatization Working Group that was already highlighted by the previous speakers, the United Nations University Institute of Global Health, and us at the School of Public Health at the University of Western Cape. And on the launch of some of the results as part of our collaboration on highlighting research priorities for gender and COVID-19. We'll put the links in the chat for the launch of that BMJ series just now. We held a webinar to convene African collaborators to talk about this. And Professor Agnes Binawaho was there, a few others that really took stock of current needs and explored the importance of regional partnerships. So that was the first conversation a little while ago. And coming out of that webinar, next slide, please, was really the demand for establishing the community of practice as a first sort of port of call as a mechanism to bring different collaborators together. And another output that came out, as I mentioned, was the special series on gender and COVID-19, and particularly this piece that Professor Agnes Binawaho is the senior author, that really recaps what celebrates the actions, the responses from African governments, but points out key ways that further change can be supported to advance gender equality based on violence, the responses to violence against women, the importance of cash transfers, and the importance of community mobilization. We will be putting those chats shortly. So those were the initial demands and collaborations. If we go to the next slide. We have as objectives, as the previous speakers have also said, we really wanted to bring colleagues together for collective learning, and not just learning, but action. How do we inspire further coordination and synergy for action? And there's been so much written about decolonization of global health, but one part of doing that is really strengthening national and regional responses. And that's what we are endeavoring to do with this collaboration. Next slide, please. We want this to be an inclusive collaboration, and therefore it's open, and you'll see from the survey already who have responded. It's really open to everyone on the continent. We must really all come together because each constituency has something to contribute, whether it's their own lived experiences, their own particular knowledge, different disciplines, different background experiences, different roles to play in connecting evidence to action to advance gender and health on this continent. Next slide. I think that was my last slide. I'm going to hand over and introduce Dr. Joanna Riha from UNU-IIGH. She has been a tireless champion, but also someone who never stops connecting the dots to making things happen. Thank you, Joanna, for going over the results of what we've heard from you.
Thank you so much, Asha, and it's a real pleasure to be here today. And I'll be presenting, as Asha has said, some survey results that came from a survey we did last year. So I'll just kick off by letting you know why we did this survey in the first place. And I think being very conscious and cognizant of the fact that this community of practice is about coming together, we wanted to begin by really listening and incorporating the needs of prospective members in the formation of this community of practice. So being very intentional and very thoughtful about collectively shaping this group and network. And so we wanted to do this brief survey to really allow prospective members to share their views and their thoughts. So I'll share some of those findings next. So the survey was sent out, and we have tried to be very intentional, as Professor Ntumi mentioned, about at least being bilingual and trying to bring together, the Anglophone and Francophone perspectives as much as possible. So the survey was sent out in French and English via personal emails, listservs, and various other networks. The survey was left open for about a month. And we had 125 respondents. 118 of those were in English and 7 were in French. And participation was primarily from women, which is very interesting. I mean, as we've heard from some of our other keynote speakers in terms of the inequalities that exist, the participation and the force behind that participation was primarily women. In terms of where responses came from, they were really spread, across the continent, somewhat, less representation in North Africa. And this is something we're, very pleased and honored to be hosted, and part of the Africa ExCon in Cairo is to build those networks in North Africa as we expand this community of practice. Over 80% of respondents were situated on the continent. We did have responses from others globally working on the continent. And countries represented, across a diversity of regions in terms of 8 countries in Western Africa, 9 in Eastern, 4 in Central, 3 in Southern, and as I mentioned, less representation in Northern Africa. It was Egypt, where we did get responses from. And just to highlight, a lot of responses were actually sort of clustered around particular countries. So the vast majority were from Nigeria, South Africa, Uganda, Benin, and Kenya. In terms of, the professional roles and organizations that respondents worked with, the vast majority were working in private not-for-profit organizations, so over 43%. The next sort of large group or constituency were those working in universities, so research, a number working in other independent organizations, as well as 11% in government, and 9.6% from working in multilateral organizations across the continent. A much lower proportion were donors, and that's also something, as we think about what next for this community of practice and perhaps other groups to build engagement in, is something to consider. Now I'm sharing a brief slide, still focusing on sort of roles and particular, areas of work, if you like, for those respondents. So the vast majority were working in program implementation and service delivery. The next sort of large group, 23%, were working in research as well as doing monitoring and evaluation. Just over 13% were involved in community engagement, 12% in teaching, 9% in policy development, so policymakers and decision makers, and then a smaller proportion in advocacy and less in communications and media. One of the things we did want to ask and find out from everyone is, given we are trying to establish this community of practice, what were some of the existing networks that people were involved in? And about 60 participants sort of reported either being aware or being part of different networks on the continent. The one that was sort of the most consistently reported with regards to gender and health was the Women in Global Health network. Femnet came up. We did have reports of a male engagement task force. There was the Africa Gender Networks. So a real smattering of a variety of networks, both at regional and at national level. And I think, again, as this community of practice grows, it's important to consider building those links and better establishing links with what already exists, so we do not duplicate efforts and work in silos. As I mentioned at the start, we were very intentional to understand language, and obviously with the relatively small number of responses given the population on the continent, there is definitely an English bias, and I think this is something we need to be conscious of as we look to expand the community of practice. So the vast majority of responses were from English speakers. We did have 12% of responses from Francophone French speakers, as well as Lusophone and a few even Spanish. So something to consider. And the next part of the survey was really asking people how would they like to engage as part of this community of practice, and a variety of different sort of social media, platforms were listed. I mean, email was one very predominant type of or form of engagement that people thought would be best suited for them moving forward. WhatsApp came up as well as Facebook and Twitter. And again, this is something to think about as the community of practice evolves. In terms of how, rather than disseminating information out, how would members of this community of practice like to participate? And responses from the surveys included presenting in a webinar, and that was really something that a vast majority of people said that they would be very happy to do. Or be a discussant on a webinar, share information in a closed email group, sharing information on social media, and some reported being willing to even write a blog. And just to note, these are not, we asked them to tick as many as they felt that they would be willing to do in terms of forms of engagement with the community of practice. And I think I'll stop there. I mean, I'm very happy to take some questions. Dr. Loazi, can I hand over to you? I know this is a hybrid format, and we're trying to engage those online as well as in the room. So for the Q&A, if I can hand over to colleagues in Cairo.
I think we need the audio from the ExCon.
Sorry, I don't think the audio is working. Dr. Manzi, 1 second, let's. Okay, we can hear you now.
Thank you, Dr. Loazi. Yes, sorry, we lost your mic. Thank you so much for taking us forward.
Okay, thank you. Thank you so much. I was saying that we've had some colleagues that have joined us as the presentations were happening. So I'm just going to do a quick recap for them, very quick recap. So welcome to those who have been able to join us. We are launching something that we are calling the community of practice, because people who are working for gender and health on the ground were saying that they don't have enough access to each other, and they don't have enough access to information about funding, about the policies that the governments are setting, about the laws that are being made by lawmakers that are supposed to help them with the work that they are doing on the ground. So they asked us to set up some kind of a platform. And we did a survey and we found that indeed many of the people that were asking for this were people who were doing work on the ground for gender, particularly for providing or facilitating access for women, children, and adolescents, so a very gender-lensed approach to work. And they said that they wanted us to do this thing on the web so that they can easily join the community of practice whenever they need to, and they can interact with each other and with enablers as well. So this is what this event is about. And I don't know if there are any questions from the floor. You can just raise your hand. And can we just check if there's any questions from either the chat or the live stream? Thanks. Are there any questions from the chat or the live stream? If there are no questions, there's a comment here that from a YouTube viewer who has also asked that we actually ensure that going forward there's also Arabic translation, and we certainly take note of that. If the survey, yes, okay, so we can certainly translate the survey in Arabic and publish that. And it may also be good to do it in Portuguese, so the team will take note of that. I understand, okay. We will engage the UN University to actually see if we can conduct the survey in Arabic as well. So in the absence of any questions, seeing as time is already way over, I think we can move on to closing. Thank you so much. And we invite Professor Maha El Rabat to close. I'm sorry, Chair, to take over. It's just convenient for me to do so. And as you know, Professor Maha El Rabat is a member of the COVID-19 Commission, is former Minister of Health here in Egypt. And if I may say so, has really become a mother and a mentor to me as well, which is really, really important for those of us who are trying to make our mark in this global health architecture. So thank you so much.
Thank you very much for the very good, nice words, and thank you very much, everyone. And of course, it gives me great pleasure to give the closing remarks of this very important launch of a very important and needed initiative. So as we come to close to this event, allow me to thank you all for attending, both virtually and in person. And we hope that you did enjoy this webinar, whether the keyword notes, the survey results, and it has given us like an overview of things that are going to be undertaken. We hope that you have all a good sense of the significance of building such a network. We have listened to many very important, I don't say slogans, but gender is part and parcel of all the strengthening and all of the development interventions. But it's easier said than done. So what should we do and how should we do it? For me, I always say gender in all policies. As we say health in all policies, now I say gender in all policies. We've listened to words like collaboration, coordination. So nothing is going to be achieved unless we are really sure of having this coordination framework and this collaboration and the partnerships that are harmonized in order to achieve the results that are needed. So we hope that all of us had a good sense of the significance of building such a network in Africa, the Africa Regional Community of Practice on Gender and Health. And on behalf of the organizers, I would like to express my sincere gratitude to all of the speakers who availed themselves to be part of this important webinar. Professor Dr. Adel Al-Adawi, we thank him very much for accommodating the virtual launch in the Africa Health ExCon 2023 in Cairo. And we appreciate and thank the Secretariat and members of the COVID-19 commissions, Professor Olive Shisana, of course, Professor Agnes Bin Buaho, and Professor Francine Notumi for officially opening the launch of this important African regional community of practice on gender and health today. So thank you all to the presenters, Professor Asha George from the University of Western Cape School of Public Health, Dr. Joanna Riaha from the UN University International Institute for Global Health, and we further want to appreciate and acknowledge all the hard work from the organizing teams from the Africa Health ExCon, working collaboratively with the University International Institute for Global Health, for the UWC School of Public Health, and the AU COVID-19 Gender and Stigmatization Working Group, which is headed by Professor Sanat Fisaha, who unfortunately could not make it today. Finally, a big thank you to all participants who joined us today, and we hope for more participation and continued engagement in future webinars and in future activities that are going to be undertaken and other community of practice. So thank you very much, and by this I close this session. So thank you very much.
Thank you so much for those online and who are still there. Thank you, Professor Maha El-Rabat, for really brokering this webinar and launch for all the speakers. And I just wanted to highlight how you can stay in touch with us, as well as a special thank you to Dr. Lwazi Manzi from the AU Commission on Gender, COVID-19 and Stigmatization. She has also been such a champion and has linked us all together and was key in facilitating the session. We also are very lucky to have our own team here at the School of Public Health, Timalize Zambo, Wolde Amde, and Michelle De Jong, who helped with the survey and putting all these slides together and all the backup support, and Samba and his team for interpretation. And lastly, but not least, the colleagues at UNU on the tech side, Sylvia and Khadija, Vidisha for helping with social media, and of course, Joanna, and Raim at the ExCon, and those at the ExCon who helped us convene this hybrid session. Thank you so much, and we look forward to staying in touch and hearing more about you. And the link to the BMJ collection is also there. I really urge you, it's a fantastic expression of a lot of the collaborations from the African continent is strongly represented. Thank you so much. Look forward to staying in touch. Goodbye.